Hello and welcome. Today we're diving deep into a condition that affects millions worldwide, yet often remains misunderstood: bladder pain syndrome, also known as interstitial cystitis. We'll explore what it is, what might cause it, how it's diagnosed, and what treatments are available. Our goal is to provide you with a comprehensive understanding of this complex condition. Unfortunately, the exact cause of bladder pain syndrome is still a mystery. Researchers believe it's likely a combination of factors, rather than a single cause. Some potential contributors include a defect in the bladder lining, allowing irritating substances in urine to seep into the bladder wall. Other theories involve an autoimmune reaction, where the body attacks the bladder, chronic infection, genetic factors, or even nerve dysfunction leading to chronic pain signals from the bladder to the brain. While the exact cause is unknown, the pathophysiology involves several key elements. The protective lining of the bladder, called the glycosaminoglycan or JAG layer, may become damaged or permeable. This allows substances in the urine, such as potassium and other waste products, to irritate the bladder wall. This irritation triggers inflammation and activates mast cells, which release histamine and other chemicals, further exacerbating inflammation and pain. Nerve sensitization also plays a crucial role, leading to increased pain sensitivity and urgency, even when the bladder isn't full. Determining the exact number of people affected by bladder pain syndrome is challenging, as many cases may go undiagnosed or misdiagnosed. However, estimates suggest that millions of people, primarily women, experience symptoms consistent with this condition. While it can affect individuals of all ages, it is most commonly diagnosed in people in their 30s to 50s. Its impact on quality of life makes understanding the epidemiology even more critical. The hallmark of bladder pain syndrome is, as the name suggests, bladder pain. This pain can range from mild discomfort to severe debilitating pain. It may be felt in the lower abdomen, pelvic area, or even the urethra. Another common symptom is urinary frequency, meaning the need to urinate more often than normal, both during the day and at night. Urgency, a sudden, compelling need to urinate, is also very prevalent. Some individuals may also experience pain during sexual intercourse, known as dyspareunia. Diagnosing bladder pain syndrome can be a process of elimination. There isn't one single test that definitively confirms the diagnosis. Doctors typically start with a thorough medical history and physical examination. Urine tests are conducted to rule out infections. A potassium sensitivity test may be performed, where potassium chloride is instilled into the bladder to see if it triggers pain. Cystoscopy, a procedure where a small camera is inserted into the bladder, can help visualize the bladder lining and rule out other conditions. In some cases, a bladder biopsy may be taken to examine tissue samples under a microscope. Bladder pain syndrome isn't always neatly categorized, but it can be helpful to understand different presentations. Some individuals primarily experience pain, while others have more pronounced urinary frequency and urgency. Hunner's lesions, which are distinct inflammatory patches or ulcers on the bladder wall, are present in a subset of patients and are considered a more specific type of interstitial cystitis. The presence or absence of these lesions can influence treatment approaches. Managing bladder pain syndrome involves a multifaceted approach tailored to the individual's specific symptoms. There is no one-size-fits-all cure. Treatment options include lifestyle modifications, such as dietary changes to avoid bladder irritants like caffeine, alcohol, and acidic foods. Physical therapy can help strengthen pelvic floor muscles and reduce pain. Medications such as pain relievers, antihistamines, and bladder-coating agents like pentosan polysulfate sodium may be prescribed. Bladder installations, where medications are directly instilled into the bladder, can also provide relief. In more severe cases, surgical options may be considered, but these are generally reserved for those who haven't responded to other treatments. Because the cause of bladder pain syndrome is unknown, true prevention is not currently possible. However, adopting healthy lifestyle habits, such as staying hydrated and avoiding known bladder irritants, may help minimize symptoms. Stress management techniques, such as yoga and meditation, can also play a role in managing pain and improving overall well-being. Early diagnosis and intervention are key to preventing the condition from significantly impacting quality of life. The prognosis for bladder pain syndrome varies from person to person. While there is no cure, many individuals can effectively manage their symptoms and lead fulfilling lives with appropriate treatment and lifestyle adjustments. Research is ongoing to better understand the causes and mechanisms of this condition, which may lead to new and more effective treatments in the future. Scientists are exploring potential biomarkers, genetic factors, and novel therapies that could revolutionize the management of bladder pain syndrome. Thank you for joining us on this exploration. If you suspect you might have bladder pain syndrome, please consult with a healthcare professional for proper diagnosis and management.